Hello. I will have an open heart surgery in the matter of few days. It's going to be in 4 days. I decided to create a series of videos that will most likely help people with the condition that I have, that will show the journey, the recovery. Maybe let's start from the beginning. I will tell you what do I have, why my heart situation worsened, how it is partially my fault, partially it was depending on the factors out of my control, and I will tell you how did the decision look like, decision making regarding the surgery, and later the recovery. I would love to share how the journey in the hospital will look like, but unfortunately we are in Poland and the regulations are pretty tough here. I was counting to have some shots of those cables being pulled out, having some shots from the surgery to show you everything, but it's probably not going to happen. I will try to record as much as possible, but I cannot promise that now. So most likely how it will look like, I will make 1 or 2 videos right now before the surgery. I will spend 1 week in the hospital, and then I will tell you how my experience was like, what I was doing, what kind of medications, supplements I was taking, and then I will share with you how I was training, how I was performing manual treatment on myself, what I was doing that was helping me. I think any person going through the heart surgery can get out of that quite a lot, because I'm a physiotherapist, I'm working with athletes. I have quite a lot of experience in training, in manual treatment, in supplementation, in all sorts of treatments. So I will quite holistically approach the issue to get out of the problem as fast as possible, as best as possible, to recover my health quickly and efficiently, so I could go back to the gym, go back to the normal life, go back to work as fast as possible. I will use my whole experience of physiotherapy, from being a physiotherapist for 9 years, from working with athletes, from working with from preparing one Olympian to the Paris. I will do everything, so this would all end up well. Hopefully some people will benefit from that. So a sip of coffee and yalla. I have a problem called Hypertrophic Obstructive Cardiomyopathy. It's a genetic problem of the heart. The problem involves 1 in 700 people. So in Poland alone, where we are, there are around 50,000 people so with that problem. So most likely some of those people will watch this video, but the issue doesn't concern them only. It concerns their parents. They very often get to know that their kid has HOCM even before they are born. The ultrasound can figure that out. That was in my case 30 years ago. So we already have a potential of 150,000 people that are involved in the situation. Then we have doctors and physiotherapists. I'm not sure how many doctors and physiotherapists will want to know perspective of a patient, but hopefully it will bring some value as well. There is not many videos of people who went through the cardiac surgery from the perspective of a patient, and there is none that I found from the who have a problem with cardiomyopathy. I know it helped me watching videos of people who went through the mitral valve exchange. Was very, very helpful. My surgery will be a bit more complicated, a bit more straining. It's called Septal Myectomy, which is okay. Let's take a step back. I will tell you firstly what my problem is. Some people can get here by an accident. Maybe not everyone know what is that. Because of the error in the genes, my heart is larger than average. But overall enlargement is not a big issue. The issue is that the septum of the heart, so the part that divides heart to the left and right, is too large. The norm in a grown-up person is to have 6 millimeters to 10 millimeters of the septum. So basically it's very little. And in my case, it's on average 2 centimeters. In one place, it's 3. It's quite a lot. And what to do? And enlarged septum causes a challenge for the heart. If you will look at that, you will see it here. Since the left ventricle pumps the blood directly to the aorta, later this blood travels to the rest of your body, enlarged septum causes obstruction. So instead of clear shot to the aorta, there is the obstruction, which causes so-called gradient. A gradient of pressure inside the heart. A healthy person should have none. Or it is accepted to have 20 millimeters of mercury to have this obstruction on the level of 20 millimeters of mercury, which is a little bit. In my case, it was varying throughout my life. When I was born, it was 90 millimeters. That is why I was put on beta blockers for the first 7 years of my life. So the good thing is that I outgrow my problem after 7 years of my life. I was born with 90 millimeters of mercury, then throughout my life it decreased to 30. So basically it was like nothing, a little bit over the norm. So that's awesome. And I had actually no symptoms that I was aware of. Perhaps my norm, I don't know what is normal. I don't know how the normal person would feel. But for me it was fine. I shouldn't do certain things. I shouldn't strain myself having this kind of a problem, honestly, but I was doing that anyway. And I was going to the gym, I was boxing for a few years, and I was doing all sorts of things, hiking on the pretty high altitudes. I was not stopping myself. I was basically throughout most of my life thinking that it's just bullshit, because for me it was like an imaginary problem. Like I can lift heavy weights, I was benching 100 kg, I was deadlifting 160. I was like, who the hell they're thinking, you know? Like there are multiple levels to that, and in the shortcut, to don't get too deep into that, I was very stupid to don't treat that seriously. But in the same time, even if I would understand how serious my condition is, I would probably still do the same. This is just who I am. I really value certain things. I really value the life that I have, which is pretty adventurous, let's just say, which is very active. My whole life right now circles around being active, about being a physiotherapist, about going to the gym, about trying different sports, and I don't see myself being happy doing anything else. So most likely, yeah, I don't see myself living different lives. So whatever it is right now, it is like this. I was not allowed to be a part of physical education classes. I was always told by the doctors, you should have a peaceful life, slow life, stress-free. And I didn't listen. Like, I was unfortunate enough to be born as a person who is active and who likes adventures, who likes to travel a lot, who likes to try different things. This is one of the reasons why I took a bit too risky decisions in my life, which led me to the situation that I am right now. Partially is not my fault at all, but partially it is. And I have an idea that sharing this journey will help some people who don't treat this issue seriously to understand it better, so they would know what's going on, to prevent from happening the same what happened to me. Or maybe what is happening to me is good. Maybe that was a God's plan. We will see in a few weeks, honestly. Well, what can I say? I was born with that. My gradient decreased to 30. I was living normal life. Then a few things happened, and I slowly noticed that my performance overall was decreasing, that I feel more and more fatigue over time, but I was neglecting that, blaming some other things. And unfortunately, on the 29th of December, I had a cardiac episode. The biggest issue of HOCM, the biggest problem that causes cardiologists to treat that very seriously, is that people with HOCM have a risk of sudden cardiac death, which means that someone just goes for a walk and they just die, or they sprint to the bus and they just turn off. And that's the biggest issue with this kind of problem. There are some associated risks. Some people have a syncope, so they faint. Some people have fatigue level, what I have right now, swelling of the ankles, stuff like that. But the biggest issue is a sudden cardiac death. Yeah, I had a cardiac episode that could end up exactly like that, and I survived that. The issue is that right now my gradient is 90 millimeters of mercury, and it's pretty bad level. I am pretty limited in what I'm doing. I have a big problem tolerating the exertion, and randomly I have episodes of my heart beating in a very not funny way, and yeah, decision was made that I have to undergo some sort of a treatment, and there were three options. The first option is are the medications. It requires constant constant checkups. It considers that I have to take quite a lot of medications to the rest of my life. Honestly, that's not an option. No way I'm going to play with that. I'm the person who has a big, I appreciate the independence. I don't want to think about that problem anymore. I want to have it solved. I expect a lot of stress in my life in future, in physical stress. I would like to hike Himalayas. I would like to have kids in future. So I cannot allow myself to be thinking about something else all the time. I want to have this repaired and done, and I forget about it. So medications, it's not allowing me for that. It's basically only for people who are too afraid to have a surgery, or because of some health conditions they cannot handle the surgery. And I don't like half measures. They don't really work for me. There was one cardiologist. That was the worst consultation that I had. I was strict. I want to have it done. I want to have it repaired, if that's an option. I want to forget about the problem. I want to move my life forward. I want to feel safe about my heart. I don't want to have in my head the feeling that I have a bump in my chest. And he was like, no, we will take care of you, we will take care of you, this medication, this. I was like, but it doesn't solve the issue, right? So I have to be like very good friend with a doctor, like all the time, to the rest of my life. I was like, no way I'm going to allow for that. I want to spend in the hospitals as less time as possible. But for some people it may be a valid treatment, but not for me. The other treatment, surgical already, is so-called alcoholic ablation. The treatment is about entering through the artery in the thigh, going all the way to the heart, injecting the alcohol into the septum. Some part of the heart is damaged, and it shrinks over time. And theoretically sounds awesome. There are very nice results having this kind of thing performed. But I had quite a few issues with that. When I saw the statistics, between 15 to 30% of people who underwent this surgery, this procedure, have the recurrence in the next 10 years. So imagine, like, everything is done, you forget about it, you go for skiing, and at some point it happens again, and you need to have a freaking procedure done again. So the fact that very often it doesn't solve the issue completely made me think like, no, I don't want to think about that all the time, thinking that it may come back, thinking that I have to stop myself from doing something. That then I was like, yeah, it's just not worth it. Like, it's worth it, right? If this would be my only option, awesome. If I would have, I know, diabetes, some other associated things, then awesome. Then this is a much better option for me. But I'm young, I'm 30. It's just not perfect. The second issue that I had is that my electrical system of the heart right now is fine. With ablation, the risk of having the nerve damaged is much higher. And when it's done, I would need to have ICD applied, injected here. That will stay with me to the rest of my life. And once in between 5 to 10 years, I would have to go for the small surgery to replace the battery. I don't want to have anything implanted. Like, basically, I want to minimize that risk to the floor. If this would be my only option to live a good life, then fine, like, I would take it. But if I can avoid that, awesome. I will do everything to avoid that. And in some cases, the risk of having ICD implanted reaches even 20% after this procedure. It all depends, right? A lot of people who undergo ablation already had some arrhythmias, some problems with electrical system, which highly increases the risk. I don't have that, but the risk of having the nerve damaged was pretty high. The third option is so-called septal myectomy, and it's an invasive procedure. They open my sternum, they go to the heart, they enter through the top, through the aorta, and they basically peel off with the scalpel the part of the septum that is enlarged. And now you can think that, oh, that's pretty straining. Well, it is, but at the same time, the side effects are very low. And so basically, the chances of the fact that I will have any procedure done in the future for that is like extremely low. It's like few percent. Once it's done, it's done. I have a peace to the rest of my life, if everything goes all right. The chances of nerve damage is very low. They can peel off the septum in a very safe way, which massively decreases the chance of the nerve damage. So yes, the recovery will be much harder. It will take around 3 months for me to feel normal. After 3 months, I will most likely decide to have the metallic sutures in my sternum removed, most likely. I don't have to want to have any metal in me if it's not really necessary. So yeah, those two benefits. Actually, they spoke to me. Just this perception that yes, I will need to take care of the scar, those sutures, the recovery will be longer, but once it's done, it's done. Like, I'm going back to normal life. I have a nice scar that reminds me of something that I went through, but in 2 years, realistically, maybe 3, I will make my dream. I will hike in Himalayas. I will go to Nepal and I will have a nice trip, and I will have kids, and I will not stress myself after not sleeping through the whole night at all. If I don't sleep well, I will have the cardiac episode again. No, I will respect myself, definitely, but I will not have to be afraid. I don't want to live in fear. I prefer to go through this whole big fear right now rather than living with a small fear throughout my life. I want to have it done. That is why I decided for this surgery. Okay. I am not even sure how it is to feel normal. Like, basically, I was living with this, with some degree of obstruction my whole life. I wonder how it is to have none. How my performance, how running will feel like, how gym will feel like. That would be awesome. I'm pretty excited, honestly. It's not a nice feeling to stress my wife, my parents, I didn't even tell my parents, honestly. They think that I have this less traumatic procedure now, as well as my brother and few of my friends. I didn't want to stress them. It doesn't feel nice to keep all of this to myself, but I decided that that's the best decision. It's now that I'm stressing. I don't like stressing everyone around. That's not nice. That's life-changing experience. The good thing is that my condition is well studied, and there is a solution for that which has a very high efficiency rate. The doc that I will have the surgery with, he did 200 of those surgeries. He knows what he's doing, and the mortality rate is like 0.5% so far. I will survive that. Like, I will not die for sure, which makes me feel like, okay, I will wake up. The question is how I will wake up. When I will wake up, I will most likely still be on opioids. So I already had a few surgeries in my life. I know that when you're on opioids, you feel amazing. I'm not sure if it will feel amazing, most likely not, but the first 12 hours after the surgery is not the worst. The worst is 24 to 48 hours after the surgery. That's the peak of inflammation in your body. So thinking, feeling, everything is awful. This time is just about the distraction. Eating will be a problem. Drinking will be a problem. The challenge would be that I will wake up with the tube in my throat and I will have to pull it out. Pull it out when I'm conscious. That's not going to be cool. The good news is that people very often don't even remember that later, so maybe I'll not remember that as well. There are much more things that I would love to talk about, but that's kind of the basic of what is happening. In the next videos I will talk about this cardiac episode, what things led to that, to this aggravation of my situation, how I recovered from the cardiac episode, and this whole preparation for the surgery. How did it look like? So yeah, that is what is going to happen. Thank you very much for listening to that, and see you soon.